Caffeine for headache. How it works and backgrounds. For headaches, caffeine instead of pain tablets? An espresso with lemon when a migraine attack begins? This is a popular tip to cure headaches. But what is really behind it? In fact, caffeine can relieve headaches, which has now been scientifically proven. It also has a vasoconstricting effect, a factor from which a headache sufferer can benefit. But the old home remedy is not to everyone's taste, and the effect depends heavily on the caffeine content of the coffee. Caffeine is always used in the same amount as an active ingredient in pain tablets in the same way as paracetamol and ACE for headaches, such as in Tamiflu Classic and Intensive. Here it not only works as an individual pain reliever substance, but also potentiates the effectiveness of the other components. In general, adding 100 mg of caffeine to a pain reliever can achieve an additional pain-relieving effect, which corresponds to a doubling of the analgesic dose. Studies have so far shown 4 effects. Caffeine works similarly to ACE for headaches. Caffeine gets into our bloodstream very quickly. It can be detected after about 30 to 45 minutes. This distributes the substance in the body, stays there for about 4 hours and is then excreted in the urine. Meanwhile, the substance not only wakes us up, but even caffeine relieves headaches. Researchers have now found out why this is so. A study shows that the plant substance in the body inhibits the production of so-called prostaglandins. These are tissue hormones that play a major role in the development of pain. About the same effect unfolds, for example, also acetylsalicylic acid, ACE, in its analgesic effect. The drug only starts at a different point in the prostaglandin cascade. This is one reason why ACE headache treatment can be complemented well with caffeine, the scientists conclude. The combination with classic pain relievers such as aspirin and paracetamol is particularly successful in the treatment of migraines. Why caffeine makes ibuprofen stronger and faster. Caffeine has a mechanism of action that also inhibits the transmission of pain. This complements the mechanism of action of painkillers and increases and accelerates pain relief. The accelerating effect of caffeine, which has already been well documented for ACE and paracetamol, has also been shown for ibuprofen. In terms of pain-relieving effectiveness, the combination is 40% superior to the single active ingredient over a period of 8 hours. The difference becomes clear after 15 minutes, with good tolerability. In addition, the combination helps more patients than just its single active ingredient ibuprofen 400 mg alone, so that 40% more people experience significant pain relief. How caffeine can stop headache trigger in the brain. Another study shows that caffeine can increase the release of the pain-relieving hormone norepinephrine in the brain. Therefore, a combination of caffeine, paracetamol and ACE is recommended for headaches. Because the two drugs in turn lower the level of the pain-causing hormone dopamine. In the case of headaches, caffeine complements the active ingredient duo perfectly. Combo preparations for headache, the combination of caffeine, paracetamol and ACE. In headaches, caffeine works like a kind of accelerator, when it is combined with ACE and paracetamol or ibuprofen. In fixed combination preparations, aspirin and paracetamol are so ideally combined with caffeine as a booster that they act 15 minutes faster than their corresponding individual substances in headaches. Also in combination with ibuprofen, there is a superior and faster effectiveness compared to the single active ingredient ibuprofen. At the same time, the amount of active ingredient of the individual substances per tablet can be kept low, which makes them even more tolerable. From the point of view of the relevant specialist societies, combination preparations are therefore the means of first choice with a highlighted recommendation.